everybody, I'm finally doing another video. It is 2 years and a couple gray hairs later, but we are going to talk about neck pain. That was the next issue that someone had pointed out to me that they wanted more tools for. So there's so many different types of neck pain. I'm just going to go over points that are generally beneficial and areas that most people do struggle with. So let's start with some points that are on our hands that help with neck pain here. One point you may know already if you watched my video on a lump in the throat is this point right here. This is in the lung channel. You find it by interlocking your hands, your index finger and your thumb. And at the tip of your index finger, you'll find a depression between the tendon and the bone. And that can be a little bit sore, but you'll feel that little divot. And that's a great point for anything in the throat, but also neck. So this is more anterior neck pain, front neck pain. If you go along that line, just sort of like along the ridge of the radius bone, just kind of finding areas that might be bumpy or tight, especially more towards the wrists, you'll find that that might correlate to some of the neck pain you experienced. Another great point for acute neck pain is if you look between the head of the metacarpal bones between your second and third fingers. There's so kind of like find the knuckles, and then if you go into the divot between the second and third knuckle, that is a great point. That can be also sore, and a lot of times these points are more sore if you have something going on, and this one is great for sort of like you really feel acute neck pain. It came out of nowhere, that kind of thing. And you can do this on both sides. So you use applying pressure with just your index finger is pretty comfortable. Any of the fingers. Probably your second or third finger will give you the most control. Another point that's kind of outside of this area that you can use for neck pain is along the inside of your foot. I'm not the best at camera angling, but so if you see my foot here and this medial malleolus of the ankle, anywhere in these lines, going up from there to about here, going into the divot between the medial malleolus and the Achilles tendon, and then running your finger, your thumb, up along the tendon. And you can rub that area or find the specific spots. A lot of times these specific spots will correlate with specific areas of neck pain. So this line here, right above the medial malleolus, this line right along the Achilles tendon. You can also do one slightly in front along the edge of the tibia. Okay, so these cluster of points work really great for the opposite side of your neck. So let's say I'm having right neck pain along the back, along the side, then I would use my left leg and try to find tender areas. Let's see here. So let's go to more points actually in and around the neck. A lot of times people have neck pain because they have jaw tension. So couple points here that really help with that kind of pain, and jaw tension can definitely contribute to neck and head pain. If you find where your ear meets your head at the top and run down to below the zygomatic bone. This is the bone, this is your cheekbone. And then when you smile, you can kind of feel the bottom of it. And just run your finger along that about an inch. And then open your mouth. And this point will disappear. Will feel fleshy when you open your mouth. And that's a point in the stomach channel, and that can be very sore on people. Oftentimes you can hear people jaws click in this area. This is a good point to massage. I would caution here to apply gentle to moderate pressure to tolerance, because you know, with jaw pain, there are alignment issues going on with your teeth, and you don't want to make your jaw pain worse, and that can happen. So how do you find what your tolerance is? You just apply light pressure first, and you feel resistance, and then leave it there. Don't try to go beyond that limit. You can just kind of feel gentle pressure. And then with this point, you can just lightly massage up and away, like up and towards your ears, like that. Another point for that is down in here. You find the corner of your mandible, and you go in about 1/2 inch to 1 inch, depending on the person, and you'll find a tender spot here. So this one is more if you have kind of like low jaw pain. So some of this tension really radiates up and behind the ear and to this very special point right here. This is in the gallbladder channel. So a lot of these points are going to be tender with neck pain. How do you find this one? So find the base of your skull. If you go from the center, you'll feel this fleshy area. This is another great point. This is in the UB channel. So if you have head pain that is in the base of the skull, that's a great point. That can contribute to neck pain. But this one is a little bit more lateral. This one is more common when there's neck pain. So if you find that fleshy area, and then just go lateral a little bit, you'll find a divot. And that point, you can use what I'm doing, like an index finger, until you get sore. Or there's this handy tool called a Theracane. It looks like this. And it's just nice to do if you're by yourself. You know, you can use some of these different protrusions to find the spots. This one's a good one for the related point. In the upper traps, you'll find if you, let's see, I'm going to try to show. It's the top, the highest point of that muscle. So this is very tender for people, especially if you're working from home, you're on the computer a lot. And this is where this can come in a lot of really handy. So, you know, you can just use the weight of something like this to bring it down. If you don't have anything like this, I would suggest using the weight of your arms and elbows, using all 4 fingers to grasp that muscle and just pulling down. Okay, a couple more points that are commonly tender on people with the neck. I'll try to talk into the microphone as well as show you. So this point right here is at the C for transverse process. Doesn't matter. Basically, how you'll find it is go towards the middle of your neck from the back, and then with your index finger, just kind of run it out until you find a tender spot that feels at the edge of a bone. So you might find that a lot of the transverse processes, this is the area, this is part of the cervical vertebrae. Those all might be tender, you know, and this is where a chiropractic adjustment might be helpful, especially when there's like uneven tenderness on the left to the right. So that's something to seek out. But this is a commonly, like right at this level, kind of at the same level as your Adam's apple. Okay. Another one is, we found GB20 earlier, that divot here. If you come down, if you go more medial, so more into the center, and then come down about an inch, this point can be, this point right here I'm going to show you, can be very, very sore on people with neck pain, right here. This is often more of a muscular issue, just kind of a common area for it to knot up. And then another point that I'll show you in the neck and upper back that helps with neck pain is, I'm going to use the theracane here. This is a point that attaches the levator scapula muscle, and that's another kind of like work from home muscle when you're typing and shrugging your shoulders up, that gets overworked and tight. So let's see. So from the point at the upper trap that I showed you, if you go down towards the corner of the scapula, corner of your chicken wing bone, if you go like this, you'll find it right here. So here, one way to do this if you don't have any tools is to find that spot with both hands, and this will apply a lot of nice pressure. You can do a lot of breathing here. You can flex your neck forward, and you'll feel tension releasing kind of all down the spine. That will help with neck pain. So with a theracane, it's kind of nice because I can find that spot and press in different angles too. Let's see, is that all I wanted to show you today? I think so. So good to see you again. I will try to do more videos as well. If you have anything in particular you want to work on, let me know. All right, thank you.